How many of you people heard of NORML?
It's not really a war on drugs. It's a war on drug users.
A special report on medicinal marijuana. It's been approved by Arizona voters and helps cancer patients. So why is it still illegal?
There is nothing so dangerous about marijuana to justify treating it any differently than we treat diet pills, sleeping pills, alcohol, tobacco.
Without the cannabis, I would be, first of all, if I were alive, I'd be in a wheelchair.
Alcohol causes 100,000 deaths a year, and marijuana's never killed a person. You cannot die from an overdose of marijuana.
When marijuana comes into its full flower as a medicine, we're talking very large numbers.
Drug Policy Archive at UMass is a new initiative to try to document the history of prohibition of controlled substances in the U.S. And it really began a few years ago when we contacted National Organization for Reform of Marijuana Laws, and through them, Lester Grinspoon. And between the two of them, they helped to shape fairly early history of grassroots opposition to prohibition. And in Lester's case, also the sort of approach to the therapeutic benefits of marijuana in particular. For researchers, I think the two collections, in particular the Drug Policy Archive more generally, as we hope it'll be, going to offer an opportunity to get in to look at a period of time in which America has made tremendous changes. First, socially, into accepting drug use at some level. Secondly, to turning that social acceptance of the use of drugs in certain circumstances into an attempt to change public policy prohibiting use.
Colorado's taken a step forward and demonstrated that it is far more evolved on marijuana and marijuana policy than a lot of other places around the country. We're moving forward as a state, and we're going to be moving forward as a country, so it's time to get on board and start basing our marijuana laws on the facts, and that's what Colorado's going to be doing.
And finally now, I think we're entering a phase where we're beginning to see public policy beginning to shift around to reflect social realities, and also a growing acceptance of the medical therapeutic uses of marijuana as being essential for health care.
Grinspoon says marijuana can ease the symptoms of many diseases, particularly the nausea and wasting associated with AIDS and cancer chemotherapy.
As more and more doctors come to understand how useful it is, I think there will be growing pressure on the part of various medical associations to make the necessary changes so that people can get this medicine.
The two collections overlap in certain regards, and they're different in certain regards. Lester's collection, Lester Grinspoon's collection, includes everything from research on the therapeutic benefits of marijuana to cases where he was called to be an expert witness relating to marijuana, to all the other endeavors that Lester has been involved in his career. The NORML records are really a bit more diverse in some ways than the Lester's, but they overlap quite a bit. NORML was very heavily involved in providing support for people who were imprisoned for either possession or sale of marijuana. They've been involved in legal cases brought against the Drug Enforcement Agency or other state and federal agencies, tracking research on marijuana, use and sale and so forth. So there's a diversity of material in there, and it gets down to photographs of conferences NORML had, audio recordings, video recordings, all sorts of different things that reflect the grassroots level work that they've done for 40-some years.
It is time we stood up publicly and said for all to hear that we are no longer going to put up with these obscene and immoral policies that define otherwise law-abiding marijuana smokers as criminals.
So as archivists, our job is to reach out and to find those pockets of archives that sit out there wherever they are and preserve them to tell the story of the movement and the people that we're documenting. Drug policy archives deal with an area that is fairly young, really, in the large scheme of things. There's activism on behalf, goes back a long ways, but as a conscious movement, it really only goes back to the early 70s. So it's old enough that some of the early founders are disappearing. Some of them are already gone. Some are disappearing as we speak, and many have not kept anything all the way along. So we need to reach out now and find those people who were pioneers in the movement and capture what we can capture while we can. We know that many have already disappeared. We know that some was never kept. But the more we begin to talk about it, the more we get the word out, the more we find.